Hi, my name is David Emerson. I'm a long-term myeloma survivor, myeloma cancer coach, and director of People Beating Cancer. Welcome to a blog post that summarizes basically my 25 plus years of experience, my own experience regarding multiple myeloma, as well as all of my cancer coaching experience. The study linked below, one of the studies, the first studies, cited a group of young, under 50, 40-year-old young myeloma patients, which is rare, and how they lived and how much therapy they underwent. It's essentially tracking these patients over 5, 10, 15 years, all who had undergone the standard of care, basically aggressive multiple myeloma therapies. Aggressive would be 4, 5, 6 rounds of induction therapy, autologous stem cell transplant, and low-dose maintenance therapy. Long story short, even the youngest, healthiest myeloma patients only lived for about 15 years. Yes, there are some patients who live longer than that, but the vast majority of people, the national average, 3 to 5 years, 5 to 7 years. It was 3 to 5 when I was first diagnosed. Now it's 5 to 7. There are a growing number of patients who live 10, 15 years, but let's be honest, they're the youngest, healthiest, no genetic abnormalities, no kidney damage, those kinds of things. The study linked below shows that. Even patients diagnosed at stage 1, young, stage 1, early stage myeloma, in my mind it is a crime to be giving the early stage myeloma patients aggressive therapies. It is, the third study I think below, is an essay written by Dr. Vincent Rajkumar from Mayo, talking about the cure versus control debate in multiple myeloma. He openly questions potentially curative aggressive therapies. In my mind, the first study documenting that even young, early stage myeloma patients don't live for 15 years. Let's face it, the 40-year-old patient sees life as a life goal longer than 15 years. Back to Dr. Rajkumar's essay, it is difficult, in my opinion, to be thinking aggressive therapies for the young, early stage myeloma patient, knowing that he or she will only live for 15, maybe 20 years. That's a real problem. These studies document the issue of cure versus control, less is more, etc., etc. There are a host of studies that talk about non-toxic, non-conventional therapies. It's possible that the control approach talked about by Dr. Rajkumar is the answer for these patients. Consider not trying to cure with aggressive therapies, but trying to control multiple myeloma. If you have any questions, comments, scroll down the page, send me an email. I will reply to you ASAP. Thanks for your time and attention. Be well.